We are here at the Prime Health Summit. It's an honor to be with Morgan Honea, the CEO of CORHIO. How are you?
I'm good. How are you?
Good. So why don't we start with your mission and what you all are focusing on. I think it's a very interesting organization, but I always like to start with the why and what the mission is.
Sure. So our mission is really about making sure that the right information is with the right person at the right time in the right place. So what we do is we build connections between all of the electronic medical record systems in Colorado and make sure that when patients show up from one system to the next, that their medical records follow them.
And this is the holy grail in health and healthcare, because for so many years it's really been a challenge. Do you see it getting better?
I do, and as a matter of fact, we're going to make a big announcement this afternoon about the ways that we're making it better, faster, and cheaper. Technology is progressing in this area. I think that pressure on the vendors and the system itself, the consumerization of healthcare is driving a lot of innovation in this space, and what we see as historically have been very customized technical work is moving more towards standardized functionality, incentives for systems to provide their data across the spectrum. And so, on the technology front, on the payment front, on the policy front, I think that we've kind of got the trifecta going right now for making sure that this moves forward.
And this is a public-private partnership?
That's right.
And talk a little bit about the ecosystem here, because I think Colorado is an extraordinary place for health innovation now. There seems to be leaders across the spectrum focusing in different areas. From someone who's here, so that others from outside the ecosystem can learn about it, what's going on here? Describe the energy.
Well, the sun is shining 300 days a year.
Can't beat that.
The mountains are 25 miles to the west. The people in Colorado, the environment that we work in is just different. There's a sense of collaboration. We recognize this Western mentality of, just picking yourself up by the bootstraps and getting stuff done, which I think speaks to a lot of what we're doing here today with the innovation space. There is a divide between the system, the healthcare system in general, and innovators. And we think that there's a lot of progress that could be made in bettering the system if innovators could be better connected and the system could be better connected to innovators. And so, through collaboration, through community, through that, mentality of don't tell us how to do it, we're going to do it the way that we know it's going to get done. I think that that's a lot of what you see in Colorado here. We have tremendous thought leadership in this state. A lot of folks whose hearts are in the right places, that really care about their community, are proud of being in Colorado. They love the state, they love the communities, they love where we live, and healthcare and healthcare systems are an important part of making sure that quality of life is really as good as it can be. And so I think that this is really the bridge between innovation and the delivery system is really what you see taking shape in events like this to make sure that Colorado, whether you live here today or you live here tomorrow, is as good as it can be on all fronts.
In your leadership role with CORHIO, what are some of the lessons learned? What advice and wisdom can you share with the ecosystem, in particular with the upstarts, with the health transformers that are just getting going?
Trust is paramount. Somebody who walks in my front door and tells me that they've got all of the answers and the magic bullet, I've heard that story, and I think we all have, so many times that I don't think that that's really going to work out here. And so the solutions are really going to have to be collaborative in nature. They're going to have to align with the priorities that we've identified for the system itself. I think our state government has done a great job of trying to bridge the gap between what's happening on the ground and what's happening in policy and other areas and public investment. And so I think that being a part of that conversation, being collaborative, being a part of the community, understanding what are the big challenges that we're trying to solve, that's going to be the magic sauce. And I think for folks who are looking at coming into this state, there's work to be done to become a part of this community. we're very welcoming, but I think that there's also this sense of we also protect our own. And so I think that a lot of what you see, especially today, and what we're going to hope for in the future, is making sure that the folks who really have those great ideas that can make a change in our system that align with our priorities, that they have the opportunity to do that, and that is as frictionless as possible.
From the entrepreneur's perspective, things are just moving too slow still.
Absolutely.
And you think about, you see the waves of innovations in other sectors, and you're like, wow, why can't it be like that in healthcare?
Right.
And I think there's an opportunity. First of all, I think there is a lot of progress being made.
Sure.
So there's a lot that is working. But I think there's a big opportunity to learn from the innovation that's happened in other parts of the world, other parts of industry, and sort of bring those innovations back to healthcare, and we're starting to see that. And it's also one of the reasons why Startup Health is really excited to be here in Colorado, because it's such a vibrant health innovation ecosystem. It's such an important ecosystem. So what I wanted to ask you is, what do we need to know? How can we be most helpful? How can we support and our army of health transformers really add fuel to the fire of what's really going on here?
I think it's probably no different than you would find in most settings. I think what's happening in Colorado, the healthcare industry in Colorado is not big. It's a fairly small community. When I go to meetings or I go out to different conferences, as long as I'm in the state, I feel like I know most of the folks in the room. I don't know if that's similar in other places. I've not only worked in Colorado, but have spent the majority of my career here. And I think that, again, being here for a vested member of the community is probably one of the most important things. I think that there is a healthy skepticism in the state of folks who want to come and capitalize on what they may see as a good opportunity to cash in or cash out. And I think that we really are proud of the community that we have here in Colorado. And so how are you going to be a part of that? I think that that's a really critical question. And I think that that starts with being able to come in and listen and not have to be the expert in the room. And I think that humility, the ability to listen, the exhibition that you are a part of this community, you're a vested member of what we're trying to do here, those are all critical components. And I think through that, we're going to accelerate some of the solutions. I really do believe that that can be grown out of this community and taken to other places that may be innovative technology or workflows or system design, whatever they may be. But you have all of what I feel like are the right ingredients here in Colorado to get the right people at the table, get them invested in the process, and make sure that what you have at the end of the day is a really healthy product or process.
Wave a magic wand. What's one thing that, if you could just change, that you think would make the biggest impact to health here in Colorado or to the system here? What would that be? Probably
one of the biggest investments that we can make in long-term health is a healthy investment in the education system.
Yeah, all starts with that, right?
It does.
Health is such a part of the culture here throughout the state with the people, and really, you mentioned the sun and all the mountains and the great things here. What do you do to stay healthy?
I drag my butt to the gym 5 days a week. I hate to run, but I do it anyway. Yeah. I try to be very mindful of my diet. We're lucky to have 300 days of sunshine here, and so the opportunities to get outdoors are abundant. I'm from the Midwest, and so when I go home for Christmas or whatnot, the soupy skies and the icy precipitation outside, it is not all that inviting to go outdoors. But out here, there's reasons to go outside. You've got the skiing, you've got hiking, mountain biking, rivers, fishing. The list of things to do is just long and wide. And I think that there's a peer pressure in Colorado that if you're living out here and not enjoying the space, then stop taking up the space. And so you don't want to be the odd man out in Colorado that doesn't do something outdoors to enjoy the natural surroundings.
Wonderful. Well, Morgan, thank you for everything that you do to progress the ecosystem here and really push the ball forward.
Well, thank you.
Thank you.